Hello. Hello, hello, everyone.
Hi.
Happy Wednesday. Thank you for joining us. How's everyone doing?
Hello, hello.
Oh, welcome, welcome, welcome. Let us
Hey,
know where you're
y'all.
tuning in from. So glad that you all are here.
So it's okay, 7:30 now. Okay.
Perfect.
Hey, y'all.
Hey, everyone. Oh my God, I love that, y'all. Oh, I love it. I love it. I love it. Oh, it's so great.
Yeah, Atlanta, Georgia. I'm actually from small town, Georgia.
It's
So yeah, it's
so
it's it's really
beautiful.
thick.
Oh, I love it. I love it. Welcome, everyone. Welcome, welcome. Happy Wednesday. Thanks for spending it with us.
We're gonna give a few more minutes for everyone to join.
Yeah.
But if you're here, grab yourself something to drink and get cozy and give yourself some shine for showing up.
Yeah, absolutely. Absolutely. I'm sure everyone is like getting back from work. We know that you all are tired. You're carrying around these babies, right?
Yeah, and tell us your name in the chat and where you're joining from.
Yeah. I'm checking in from Colorado. Anybody in the West with me? Anyone coming in from Colorado tonight?
Well, I'm here from Atlanta. And we would love to know what Mom Cozy products you're using. What are you using? What are you loving? We'd love to hear from you.
Oh, I'm seeing a lot in the Q&A right now, but I can't access it. Are
Okay.
you seeing that on your end?
I can see it on my end.
Awesome.
And I'm actually glad that you said that because we prefer for questions to be placed in the Q&A and not the chat so we can make sure that we get everybody's questions answered. So we're going to give a few more minutes for everyone to join.
Amazing. Oh my gosh, I'm loving all of these
Okay, we have
already. Excellent, excellent. All right, what do we think? Should we get started?
Yeah, let's get started. Well,
Let's
we have
rock it.
a few more
Okay.
minutes. I don't want to miss anyone, but we have a nice group here today.
Yeah, absolutely. And remember, everyone, this is the first of four parts, right? This is the first of four parts. So hopefully, if you're tuning in for tonight, we're so happy that you're here. But this is only the tip of the iceberg. We have 3 more weeks, right? We have 3 more webinars together in the the following Wednesdays. Every Wednesday, we're going to be right back here doing another part of the series. So make sure to join us then as well. And yeah, we can get started. Do you want to go ahead and kick us off?
Am I running it or?
Oh yeah, yeah, everyone. So guys, tonight we're going to be doing postpartum recovery 101, caring for yourself after birth. I am Laura. I am a registered nurse. I'm a lactation consultant. I am a doula. I currently live in the great state of Colorado, but I'm originally from Massachusetts. So if anybody's from the East Coast, give me a little, ooh, I miss it. I miss it a lot. Um, I've been teaching for a really, really long time. I'm an educator, and we're so happy, right? I'm part of NAPS, newborn and parenting support. We have been lucky enough to be able to partner with Mom Cozy for these webinars, and just so happy to be here. Everyone, grab your water, grab some snacks, grab a little notepad and pen. I always leave about 10 extra minutes at the end of class to answer all of your questions, okay? So we're going to take a few. I can't promise that we're going to get to everybody, but we are going to take a few live questions at the end, and you can pop those into the Q&A, and we'll kind of scroll through, and we'll get to the ones that we can in that span of time. And I will let you take it away.
So, hey everybody, I'm Sonia Taylor. I am new to the Mom Cozy team. I'm on the sales team, and I'm happy to be here tonight. We're so thankful to partner with NAPS and grateful for you spending time here with the Mom Cozy community. This June, we're shining a light on something that every mom deserves, and that's postpartum health and wellness, recovery, and care. Because I think when you take care of yourself, I'm a mom. I have an 8-year-old and a 10-year-old, soon to be 11-year-old going to middle school. I think it's important when you take care of yourself, you're not just healing, but you're taking the time to build your strength up and care for your little one with love. So before we get started, I have a few housekeeping items. We want to make sure that we're putting our questions in the Q&A section and not the chat. And we'll try to make sure that we get everything answered for you guys. Also, this webinar is being recorded, so you will receive this recording within a week. Well, actually, you'll receive it next week. And this is the last thing, and this is really probably the most important. Make sure that you stay till the end. We have a big giveaway, guys. And I say big, I mean it's big. You don't want to miss this one. We will select two at the end of the call. I will select two lucky winners, but you do have to stay until the end.
Perfect. All right, my friends, let's get started. So who are we? Who are NAPS? As you know, my name is Laura. This is Emily and Jamie. They are the founders of our company. We are a judgment-free medical professional coalition who has been around locally based in Boston, but serving, nationally through our virtual outreach. We're just a bunch of medical professionals who all got together and realized that parents needed a lot more support than what they were getting in that postpartum period, right? And beyond, right? From conception, we cover you from conception all the way until your, baby is, out of diapers and headed to middle school. We cover it all. You can always count on us for non-judgmental, research-based, evidence-based education, and you're going to get a little bit of that tonight. Buckle up. This is me. My name is Laura. I've been a nurse for about 13 years. As I said, I lived and worked in Boston for a very, very long time. I've done labor and delivery, postpartum recovery. I've worked in private OBGYN offices. I've worked in home. I'm also currently a nurse doula out here in Colorado. I am a lactation consultant and I am an educator. And this is my favorite thing in the world, is to be able to teach to you all and help bring you some knowledge, and hopefully be able to, tonight at least, give you a little bit of information that you can really take home and take care of yourself, right? After you deliver this baby, or if you've already had this baby, right? Hopefully you're going to be able to implement what you learn here tonight in helping nourish yourself a little bit, right? So a couple of things for delivery and immediately after birth. Right after that baby is born, right, what we can expect is some skin-to-skin stimulation, right? We're trying to get that baby to cry after they're born. We're going to get our placenta delivered. We're going to get our epidural removed. We're going to end up getting an assessment and a weight on that beautiful baby that you just delivered. Repairs and situating mom, right? So we're going to stitch up any repairs that you might have had to have if you had a tear. We're going to talk to you a little bit about rooming in versus in the nursery, right? So this is in the hospital setting still, right? We delivered our baby, but now we're going to our postpartum floor. And this is where we're going to stay for a little while after we deliver our baby. Rooming in just means that that baby is staying with you right next to your side. They're going to be in there the whole time. Versus some hospitals do have a nursery. They have an area where you might be able to send your baby, right? If you say, you know what, listen, my baby is okay. They've fed. I am exhausted. I'm just not getting any sleep. They're making so much, they're making a lot of noise. They're really noisy breathers. And even though they don't need anything from me right now, I still feel like I'm not really getting a lot of rest. Would it be okay if I sent them to the nursery for a couple of hours and you just let me know when they're hungry again? And then I can, you can bring them back in and I'll feed them. Sometimes that can be like one of the first points of care for ourselves after delivering our children, right? Just a little bit of respite and recovery, just the ability to kind of know that somebody else has eyes on that newborn while you're getting a little bit of sleep, should that be what you need in the moment. Delayed cord clamping, right? This is when we're gonna clamp that cord, and we are going to have or offer your partner the opportunity to cut the cord. This is a great place for photos or videos. You're going to get a lot of help with feeding, whether that's breastfeeding, bottle feeding, formula feeding, combination feeding, exclusive pumping. That is all going to be available to you there in the hospital as well. And then typically right after birth, we call it like a 2-hour recovery window. Okay. So that 2-hour mark after you deliver your baby is when we're really keeping eyes on you. We're making sure that the baby is adjusting well to outside world, and we are making sure that you are nice and healthy, right? That everything is going smoothly, vital signs are stable. And that's going to be kind of like that course of care right after delivery. This is a little bit of our vaginal delivery recovery, right? So anybody who is planning on a vaginal delivery, cramping in your uterus is completely normal, right? It is not going to be the same cramps that you had when you were delivering this baby. These cramps do not feel as intense as contractions, okay? Your uterus is still going to cramp after delivery, though, because that's how it stops your bleeding, right? We have kind of a wound on the inside of our uterus where our placenta was attached. And after that placenta is born, right, we just have a kind of an open wound right there. And your uterus gets right to work in cramping down, right, to help stop that bleeding. A firm fundal massage to reduce bleeding. So this is my most hated part as a labor and delivery nurse afterwards. You've just done all of this work to deliver your baby. And then I have to come in and say, hey, would it be okay if I checked your fundus, if I checked your uterus and I massaged it? We call it a massage, but it's a deep tissue massage to try to get it nice and firm so that we know that it is contracting down appropriately to stop that bleeding. Cleaning you up after delivery. So this is everything, right? This is like we're cleaning up all the fluid, all the blood. We're getting you like fresh underwear, ice packs, Tux pads, right? We are providing you. I always make a little mocktail, a little momtail, right? Afterwards, some Sprite, some orange juice, some cranberry juice with a lot of ice. Very, very refreshing to have after delivery. Walking to the bathroom to pee. This is huge. I want all of you, if you have not delivered your babies yet, after you deliver your children, it is very important that you call your nurse for that first trip to the bathroom post-delivery, okay? There's a lot happening down there, and we just want to be with you to make sure that to reassure you, to say, nope, this is exactly what's supposed to be happening. And we want to make sure that we're giving you all of the appropriate things for that postpartum recovery care in that bathroom, kind of showing you what your routine in the bathroom is going to be like in the coming days. We're going to have something to eat and drink, right? Oh my goodness, who knows how long we've been in labor for? You're probably starving. Hopefully, right, you're going to have your partner run out and get you that like big boat of sushi or like a rare steak, right? Or something that was off limits, during your pregnancy. Really go nuts here. We're going to show you our mesh underwear, pads, and ice packs. These are the typical things, right? It's kind of like making a Subway sandwich. We do a big pad, and then we put our little we crack an ice pack, we pop that on top, and then we put little round witch hazel pads on top of that. You're gonna apply that to your perineum, and then we're gonna help you get into these lovely, lovely mesh underwear that's gonna kind of hold it all in for you. Your nurse at this point too, in this postpartum recovery period, is going to be doing frequent checks of your bleeding and your vital signs, right? If we're going to have an issue with bleeding, usually it's going to happen within that like first, few hours after delivery. So we want to be on top of that. We want to make sure that we're checking that out. We're certainly going to be supporting your baby's first feed. This is one of my favorite things to do on the postpartum floor or after delivery, is helping you with that feed, right? So supporting you however it is. If you're choosing to breastfeed, we're helping you with that first latch. If you want a bottle feed or you want a pump, then we're helping you get that set up, right? We're showing you how much to put in the bottle and the appropriate way to hold the bottle for your baby. And then quiet time to rest and bond. I cannot stress this enough, okay? Babies in the first 24 hours after delivery tend to be a little sleepy. This is the universe's gift to us, right? We don't know how long you've been in labor for. We don't know how long that delivery process took. You're going to want to take that first 24 hours and you are going to want to settle in with your baby, with your partner, right? If you have one, with whoever your support people are, and you're going to want to sleep. You're just going to want to spend time, bond with your baby, and rest. So one of the biggest pieces of advice that I can give you is to delay visitors, right? There's a lot of people who love you. There's a lot of people who want to come and see this baby. Try to delay visitors until after that 24-hour mark so that you've really gotten a chance to rest. After 24 hours, that baby's going to wake up, okay? They are going to be eaten so frequently, they're going to be up and like ready and raring to go, because between 24 and 36 hours is when they usually have their first growth spurt. So take that first 24 hours after delivery and bond with your baby and try to get as much rest as you can. For those of us who are having a C-section, right? So C-section recovery. First of all of our operating rooms are on labor and delivery, okay? Labor and delivery units typically will have their own operating rooms, right? We operate as like a separate entity from the rest of the hospital. We're going to give you your epidural or your spinal dose, right? So you're kind of coming down from that. These are, of course, given prior to the surgery. So post-surgery, you're coming down from this a little bit, right? You're kind of getting your sea legs back underneath you. Usually our recovery for C-section takes about an hour. You will typically get one support person in the operating room with you during that C-section. Our Foley catheter is placed, right? Because we need you to we're continuously emptying your bladder during this procedure. And that's also going to help us with your bleeding, right? So we're going to remove that after the C-section when you're in your recovery stage. You were doing skin to skin in the OR. You are absolutely going to be continuing that in our recovery room. We're going to feed in the recovery room. Again, same support for feeding your baby like you had the last time. And typically, right, we're looking at in the PACU, the post anesthesia care unit, we're looking at anywhere, I've seen it a lot of different ways, average is about 3 to 4 hour recovery where we're really keeping a close eye on you. Usually you're in the PACU for about an hour or two before we transfer you to your postpartum room where you're going to stay for the duration of your time in that facility. So these are a couple of things that we would expect for you after birth, all right? Cramping that can feel like mild contractions. We talked about this a little bit already. So those contractions, right, after you must be thinking, I delivered my baby, I delivered my placenta, why am I still cramping? Why is my uterus still doing this? And like we said before, it's because we do have that wound where our placenta was attached to the inside of our uterus. And the way that our body stops that bleeding is by contracting, right? It closes those blood vessels by contracting. You're probably going to feel these contractions or cramping most often when you are skin to skin with your baby, or if you are somebody who is breastfeeding when you're breastfeeding. One of the primary hormones in breastfeeding is oxytocin. Oxytocin is also one of the primary hormones in labor, right? Oxytocin contracts our uterus. So your uterus is going to continue to contract as that baby feeds at the breast, right? Because they release oxytocin. That oxytocin is also going to be contracting little muscular sacs in the back of your breast that hold the breast milk and allow that milk to come down. So it is completely normal that you're still feeling these contractions or mild cramping. Typically, right, so the cramps are happening and your uterus is getting smaller and smaller and smaller and smaller and smaller. And then usually around like the 5 to 6 week mark postpartum, our uterus is back to its size that it was pre-pregnancy, and sitting way down in our pelvis where nobody can like see it or touch it anymore. We're going to be offering you ice packs for vaginal pain and swelling. These are amazing, especially in the first 24 hours. Sometimes you don't need it. Sometimes you're not very swollen. Sometimes we have babies who kind of come right out. We have like super pushers, right? Who kind of just like, they do their thing. But on average, it takes about 2 hours, 2 to 3 hours for a first time birther to push, right? That's like kind of what we expect. If you do it less than that, amazing. But that's kind of what we would expect. So for those of you who end up pushing kind of on the longer end, you might find that your perineum is pretty swollen, right? And so using that ice in the first 24 hours can be incredibly helpful in bringing that swelling down and just offering a lot of comfort. Breast engorgement or fullness as your milk comes in. So this is typically what we would see for first-time breastfeeders around days like 4 to 5. Breast milk coming in is a process, right? We start with the colostrum. Our babies feed, 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 feed. We get transitionary breast milk, usually around day like 3. Then they feed, 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 feed. And then we end up with our mature breast milk, right? So that engorgement, that fullness usually comes with that mature breast milk, which again, usually comes in for first timers around 4 or 5 days. Now, I don't want that to be confusing. Your baby is still getting that transitionary milk and the colostrum, right? But that's the process, right? That's supply and demand. That's just kind of how our milk supply ends up coming in. Colostrum, transitionary milk, and then mature breast milk. Pads and pain meds to manage bleeding and discomfort. So like we said before, we're going to give you a whole recipe, okay? We're going to have a pad, we're going to have a nice ice pack, we're going to have little witch hazel pads, and that's going to be like your perineum pack, right? We're going to put that on our perineum. Every time we go to the bathroom, we're going to refresh it, new set of mesh undies, and we're good to go. You're also going to be offered pharmaceutical medication, right? Most hospitals will offer high strength Motrin and extra strength Tylenol, right? So Motrin you couldn't take during your pregnancy, but you sure can afterwards. And usually that's how we would handle the discomfort of a vaginal delivery. If you are somebody who did have a C-section, you will also be offered something like oxycodone, just because, right? We had major surgery, and so we want to pay attention to that healing process, right? And that we might need something a little bit extra as we're taking care of this newborn to help manage our discomfort. So those are usually the 3 that we would offer. Heat or sitz baths to relieve hemorrhoid discomfort. So heat can be helpful, right? We have ice packs and heat packs in the hospital setting, or sitz baths. So sitz baths, or you could do this either way. A sitz bath really only means that you're filling up a tub with a few inches of warm water, right? And just really settling in there. Some people will even go as far as doing like some postpartum herbs, right? They might splash that into the water as well. And that warm water being submerged, having your perineum kind of submerged in that warm water is just going to help bring blood flow to the area and really, really help with that healing process, right? And then nipple pain during early breastfeeding. So this is something that can be pretty common, but I don't want anybody to think is super normal, okay? Usually if you are having nipple pain during breastfeeding, that means that there's something we can fix about the latch. There is something going on that is causing you this. So if you are having pinching, biting, anything like that in terms of nipple pain and early breastfeeding, I want to let you know that that is not a normal course of breastfeeding, and you should not just grin and bear it. It is not just a part of breastfeeding, okay? There is something that we can do to fix that baby's latch. There's something that needs to be explored because it should not feel pinchy, bitey. That should not be the sensation that you're getting. So if you are feeling that, I need you to call that nurse in, right? To have them help you. I need you to see a lactation consultant in the hospital. And if it's continuing even after you go home from the hospital, I need you to see a lactation consultant, okay? So important, because once that pain is established, if we have damage to that nipple, it can be so much harder to bring that baby to the breast, every couple of hours to feed when we ourselves are in discomfort. So we really want to make sure, for your benefit, we want to make sure that we are like nipping that in the bud as soon at the first sign of nipple pain. Okay. The scoop on your first postpartum poop and pee. Very important subject. Okay. We want you to use a peri bottle while you pee. okay, to dilute the sting and keep everything clean. So peri bottles are gorgeous, all right? Every time you sit down to pee on the toilet, I need you to have your peri bottle full of warm water. As you pee, you are simultaneously going to spray your perineum so that we can dilute the urine and like reduce our stinging sensation, okay? Leaning forward while you pee also helps take a lot of the pressure off of any stitches that you might have, or just that like fullness or tenderness, right? That swelling that we have, right? Instead of sitting up and down like this, where everything is just like right, focus down, just lean forward a little bit and take some of that weight off of that area. Take stool softeners right away and keep taking them, please. Please, Colace is our best friend, okay? We we celebrate. As your postpartum nurse, I am celebrating when you have your first postpartum poop, okay? It can be very scary. Some people have so much anxiety surrounding it. It's like the same level that they had about giving birth to their baby, right? Because you're anticipating, you're like, okay, everything down there. I don't know what it looks like. I know what it feels like. I feel like this isn't going to be uncomfortable. And then we really get in our heads about it. So take those stool softeners. Make sure that you're drinking a ton of water, right? Tons of water, 3 to 4 liters a day, to help make things pass more easily. Don't rush it. It can take a couple of days, and that's totally normal, right? Again, we don't know how long you were in labor for. We don't know if you were, what you were eating during labor. Did you even want to eat, right? When is the last time that you had like a really steady meal to even get your bowels going? So it's completely normal for that to take a couple of days. Don't get down on yourself if it's not happening right away. It will happen. Prop your feet up on a stool when pooping. We all know this. We all know this. We want to help support our pelvic floor. Our pelvic floor has done so much for us during this pregnancy, and it's done so much for us during that labor and delivery process, during that pushing process. Those ligaments and those muscles, oh my goodness gracious, they have supported us so well. In this whole journey, we need to be very kind to our pelvic floor afterwards, okay? Ergonomics is important, all right? So get that squatty potty, prop your feet up, okay? Breathe and relax. Try not to like really, really, really push. That is again where the stool softeners come in really handy, okay? You want to let gravity do the work. When we're pushing, right? We're kind of like we might be aggravating that area a little bit, right? Adding to the swelling, adding to the pressure in the area. So we're just going to try to let gravity do its thing. And we're going to help that along, right? With our ergonomics, squatty potty, with our tons of fluids, and with our stool softeners, okay? Oh, the best peri bottle in the world. Victoria's biggest secret, taking care of your vagina post-birth. It's so true. Even if you don't pee, right? Having this peri bottle like with you is so in the shower. If you don't have a detachable shower head, so helpful with getting that area irrigated with warm water, right? Incredibly soothing. And again, it's helping us bring blood flow to the area, and that is automatically going to support our healing, okay, and expedite that process. This is your recovery checklist. Mesh underwear. You can buy these. We've got some really great brands of like mesh underwear out there. I don't want you to turn your nose up to the ones that the hospital gives you though, because those are the OGs and they're nice. Okay. You are going to be asking your nurse for extras. So we've got our mesh underwear. We've got large maxi pads. Okay. We've got a peri bottle. Tux pads, witch hazel pads we talked about, they stay really, really cool. They're even better if you put them in the refrigerator. Numbing spray like a dermaplast, and a sitz bath. So listen, everything on this side is what the hospital will have for you. So what you're going to do is you're going to ask your nurse for a big old bag of this, okay? Your partner or your support person or anybody is going to take it down to your car for you, okay? And then when the next nurse comes on staff, you are going to ask that nurse for the same bag of stuff. All right. And then we're going to take that bag down to the car. Okay. Because you're going to be using this stuff like crazy. So that's my little tip. That's my little postpartum insider information. Okay. What you're going to want to have at home, smaller pads and panty liners for the days that follow, right? Because our flow is not going to be so heavy, right? That postpartum bleeding is not going to be so heavy where we are going through those huge pink maxi pads, right? we're gonna notice that our bleeding is getting lighter and lighter and lighter, right, as time goes on. So we can switch that out when the time is appropriate to a smaller pad or a panty liner. A bottle of ibuprofen for sure, right? We're gonna be sore. We're gonna be sore. We're gonna be up. We're gonna be moving with our babies. So we want to make sure that we have that on hand in case we need it. Comfortable underwear that you don't mind tossing. Hopefully you have enough of this mesh underwear from your nurses on the postpartum floor. Should you need some extra, right, then you want to go with something comfortable, right? Something comfortable that you don't mind tossing out in case it gets some blood on it, right? Optional, ice packs or cooling pads for vaginal soreness, right? Again, first 24 hours is pretty important for a swollen vagina, right? To use that ice on, but some people like to use ice further past that. So if that's going to be you, then maybe consider having some of that at home. This is one of my favorite slides, okay? These are the things that women sometimes are told, birthing people are sometimes told, right, by their providers postpartum. There's a lot that we kind of chalk up to birth. Of course you did. You just gave birth. You pushed for this long. You labored for this long. Of course you feel this way. But just because it's common for most people who give birth doesn't mean that it's normal, okay? And all of these things are things that we need to be addressing, all right? Peeing when you sneeze, cough, or laugh, that is pelvic floor. Something is going on with your pelvic floor. How can we strengthen that? We go and see a pelvic floor physical therapist, right? Like I said, our pelvic floor has been doing so much for us during this entire pregnancy, during that labor process, during that pushing process. We need to show it some love, right? It needs to recover too. So if you're experiencing this, pelvic floor physical therapy. Painful sex even months after delivery, pelvic floor physical therapy, okay? Common. These things are very common, but they are not normal, okay? A feeling of heaviness or falling out in your vagina, not normal, okay? Lower back, tailbone, or hip pain, right? Did something get misaligned during that labor and delivery process, right? Are we having, right? Did we stretch too far with our epidural? What is it? What's happening here, right? We need to get that addressed. Going to see our OBGYN about this and telling them, listen, this isn't right, right? Maybe we have to get an x-ray, right? Maybe we need to go see our local, our chiropractor, whatever it is, right? We've got to address this. Ongoing constipation or painful bowel movements, not normal, okay? Common, but not normal. Pressure, bulging, or discomfort when standing, pain or tension when you're sitting. Abdominal separation. I'm sure that maybe you all have heard of this. Diastasis recti. So this is also something that a pelvic floor physical therapist or physical therapist can help with, right? Sometimes we have like a separation of our abdominal muscles during pregnancy. Some of you might already be experiencing that now. Some of you might not notice that that's happening until after postpartum, right? If you are noticing that that's happening, you just don't feel like your core strength is what it used to be. That's something that we need to look into, okay? And then difficulty emptying your bladder, right? So on the opposite end of every time I laugh or sneeze or do a little jig, I pee myself. On the other end of that, I'm having difficulty emptying my bladder. I can't get everything out every time I pee. I always have this, constant urge. Also, right, that is a pelvic floor physical therapy referral right off the bat. Can you see how important pelvic floor physical therapy is? So just really take a look at this slide, okay? Just because it's common doesn't mean that it's normal. I don't want anybody here to be going into their OBGYN or their midwife after delivery with these symptoms and just kind of have it be, oh yeah, well, that happens to most people. It's true, it does. It does happen to a lot of people who give birth to a baby, but that doesn't mean that it's normal, and it certainly doesn't mean that there's nothing that we can do about it, okay? Oh, mental health is one of my favorite ones. This includes both parents. Okay, so if we have partners, hopefully, maybe we have some partners who are joining us for this today. Maybe we don't. If we don't, then maybe we're passing this along to our other parent, right? 1 in 4 women and 1 in 10 men are going to experience some sort of postpartum mental health episode. Okay, perinatal mental health is from conception, from the moment that you get pregnant up until 1 year of being a parent. Okay, a lot of people feel like, Oh, it's been a month. I shouldn't feel this way anymore. It's been 3 months. My baby isn't even a newborn anymore. I shouldn't be feeling this way. I don't think that this is what's going on, right? No, it lasts for much longer than that. Okay. Conception. Maybe you're feeling a little anxious now. Maybe you're feeling a way that you didn't feel before with pregnancy, right? That is something that you want to look into. That's something that you want to talk to your provider about, right? So that we can get you plugged into the right channel so that you can get the support that you deserve. Baby blues or postpartum depression, what's the difference? So baby blues is pretty common in the first 2 weeks after delivery. This is when you can feel hormones are really raging, right? And you can feel like you can feel sad one minute, you can feel happy the next. You're bawling your eyes out because you think one day this baby's going to go off to college, right? And leave your home. And then, the next second you're like as happy as can be. You can't believe, right, that this kid is yours forever. That kind of fluctuation in those hormones and in those feelings, right? Those intense feelings, very normal in the first couple of weeks, right? After that 2 week period, usually that's when we start to see more postpartum depression. So that's when those fluctuating feelings aren't really going away anymore, right? We still don't really feel like we have like a handle on things, on ourselves, meaning, right? You're not supposed to have a handle on your baby in the first 2 weeks. You know what I mean? You might not have a handle on them until they're grown with their own children. But that postpartum depression looks different, right? This is when I don't want to interact with my baby. I don't want to touch them. I don't want to feed them. I have no interest in it. I don't want to get them dressed. You don't need to bring them to me. I don't even really want to, I don't want to. I don't want to get up and out of bed. I've lost my appetite. I'm not eating. I'm not drinking, right? That's more of that postpartum depression, right? When I worked at Boston OBGYN in Boston, as a triage nurse, we would have, I spoke to more partners about this than I did the person who actually gave birth to the baby, right? Because they were realizing that their partner just was not coming out of it, right? That something was not right. And that's all they needed to say, right? That's all they needed to call and say to me. And then we could talk about it a little bit more in depth. And then we could have them come in for those appointments. So that's a really big thing to share with your partners if they're not with you right now in this room hearing this, that they're usually the ones who pick up on it first. Okay. But just keep those things in mind. Know your risk factors and symptoms ahead of time. Are you somebody who has baseline anxiety or depression? Are you somebody who's seeing a therapist or taking medication? Then you're probably going to be at a higher risk for having postpartum depression or anxiety. And that's the way it is. So what we want to do is set ourselves up for success. We want to call our therapist. We want to make those postpartum therapy appointments and keep them. Maybe we're doing them virtual now. That's fine, as long as we're doing them, right? As long as we're sticking with them. You want to know that you have that person ahead of time, right? When you are in it postpartum, you are not picking up your phone or emailing your therapist to be like, oh, let's get together. Let's pick a time. Let's pick a day. No, you are like, you're surviving. You know what I mean? So you want to make sure that you have those things beforehand, especially if you have risk factors, right? Get on top of it. Tell your mom, tell your friends, be like, hey, I need you to check in on me. I need you to like pop in and ask how I'm doing. I need you to text me and talk to me, right? Those things, setting those things up, right, is a great way for you to have the support afterwards and not have to like do the work after that baby is there. Find out who's on your support team and who needs to be on it, right? Are you somebody who's listening to me talk right now and you're like, oh, wow, conception? That's when postpartum mental health stuff can start? Or that's when, oh gosh, I didn't realize that this, that this was a thing. Maybe I should talk to somebody about this. Awesome. Who are we going to talk to, right? Best recommendation is that you take it straight to your OB or your midwife first. And then we figure out to what degree and where do we need to bring you next? Where do we need to plug you in next to get you the support that you need, right? Who's coming to visit you postpartum? Who's coming to visit? Maybe it's not your mom, right? Maybe your mom stresses you out. Maybe it's not going to be her. But maybe it's going to be your sister or your auntie or something, right? Somebody who's going to be coming to your house to help, who's going to support, right? We always say here at NAPS, we need helpers, not visitors. We are here for helpers. We're here for people who are asking you how you are. Hey, how are you doing? What can I do for you right now? Oh, you don't know? Okay, I'm going to take this baby. Why don't you go lay down for a nap? Go take a shower. Go take a walk around the block. Grab yourself an iced coffee. You know what I mean? That's what we need. We need helpers, right? People who are making meals, people who are vacuuming, people who are folding, all of that baby laundry. How does such a tiny little baby make so many dirty clothes, right? Those are the people those are the people we want on our support team. So sit down, make a list of who those people are. Visitors versus helpers. What did we say? People who visitors are people whose intentions are in the right place, but may unintentionally end up making more stress for the parents rather than being helpful, right? Maybe these are the people, maybe these are the in-laws who are coming from out of state and they want to stay with you for a week. Because they want to meet their grandbaby, right? And of course, they want to see you guys, right? They want to see you as well, the parents, but they want to meet their grandbaby. And maybe they're not going to be as helpful as they think that they're going to be. And then all of a sudden they show up and you're like, oh my gosh, I've got to clean the whole house. I got to get new sheets. Oh my gosh, your mom only drinks this specific type of coffee. I've got to make sure that we stock the house with the coffee. Now we got to make a trip. And before you know, right, you're entertaining. Before you know it, you are stressed and you are worried about their well-being, when really we need to be focused on your well-being and the well-being of that baby, right? A helper, on the other hand, is somebody who wants to make a parent's life easier in any way possible, and they anticipate your needs or talk on the tasks that help your family, right? Hey, I know that you guys go for a walk with your dog every single morning. Consider it done this week. I'm going to swing by. I'm going to walk the dog for you. Hey, I just dropped off. It's a quick text. Hey, I just dropped off a lasagna on your front door. I don't know what your day was like, and I know days with newborns can be really variable. So in case it was a bad day, I didn't want to bother you, but the lasagna is there. It's for you. We love you so much. Let us know, if there's anything else that we can do, right? Those are helpers, right? Make your lists. Who is a visitor and who is a helper, right? Who can we lean on in this space? Because we need to be taken care of in order to take care of that sweet little new baby, right? That's what we need. Support and outsourcing. This is a full-time job. Parenting is a full-time job, especially with a newborn, especially in that first 4 weeks, okay? No one expects you to do it all alone. It truly takes a village. Here in the United States, hopefully some of you are tuning in from other places in the world where I hope that this sounds foreign to you, honestly. It takes a village, and we are trying to bring that back. Mom Cozy is trying to bring that back. NAPS is trying to bring that back, right? It takes a group of people around you to help uplift and support you. There is no shame in asking for help. There is no shame in delegation, okay? Consider all of the ways to lighten your load, even if it's just for a season, right? Asking for support is a strength, not a weakness, okay? Assign tasks like meals, pet care, laundry. If you're coming in hot you already had a baby, right? You've got kids at home and you're expecting this new baby. Childcare. Who's going to be helping me with the kid, right? Or the kid that we already have, right? The oldest. Who can I lean on for help with that? And shopping, right? To make life more manageable. Some great examples of this are just like getting your food order on schedule, right? Every Monday, we're going to have all of our staples show up to our door. We don't have to worry about it. This is just what's going to happen, right? Maybe you're going to treat yourself to some meals, some ready-made meals, right? A meal delivery service who's just like dropping off completely ready to go. You heat it up in the microwave food, right? So that you can have hot meals, and that you don't have to worry about the cooking, right? Maybe you're going to set up a meal train for yourself. That's another great idea. You all, I'm sure, have community members who want to help, friends who want to help, family who wants to help. This is a very tangible way for them to be able to do that. So assign those things, right? Divvy that out to your helpers. Choose your helpers wisely, and keep in mind that we want helpers, okay? We do not want visitors. We are not here to entertain. We are here to take care of our babies, and our helpers are here to take care of us so that we can take care of our babies, right? Amazing. So that's the end of our formal presentation. I did want to let you all know that NAPS does take lactation insurance for lactation visits now, which is the best, okay? Go ahead and scan this QR code. You can get all of the information here. Plug in your insurance information, and it's going to tell you, it's going to let you know whether you're covered or not. If you are covered, it's going to tell you how many visits you're covered for. It's going to tell you if you are covered for virtual or in person. and take advantage of it. Okay. We use these for individual, like personalized feeding plans. We use these for prenatals to talk about what your, maybe what your feeding experience was before, if you have another baby. And what if you don't, what your feeding experience wants to be like now. We take your pumps out of the packages. We go over all of the settings with you, how and when to pump. We talk about bottle feeding. We talk about combo feeding. We talk about everything. We are also using this as an opportunity to do birth and postpartum recovery prep. So I just recently met with somebody to go over her birth plan and preference sheet, which I was thrilled about, right? As a labor and delivery nurse and as a doula, we talked a lot about how to keep her in the driver's seat of her own birth experience while she was delivering in a hospital. And that was amazing. A month ago, I met with somebody to go over her induction. She was being induced on a Friday. So we met on a Wednesday and I said, this is what you can expect. This is what, these are the medications. This is typically what's going to happen. Just to help, right? Just to have that education so that you can go into that birth feeling like really confident and really prepared. So scan that QR code, check it out. Hopefully you're covered. And hopefully I'm going to be seeing you guys. Book with me. Hopefully I'm going to be seeing you guys for some of these. I would love that. Amazing. I also wanted to let you know that if you use, so we have a pre-baby boot camp coming up for those of you who are pregnant, okay? I run the pre-baby boot camps. They are weekend-long events, okay? We have not yet mailed out our boxes yet, okay? Our next one is coming up in July. So if you are somebody who is delivering in like August, September, maybe even October, right? This is a great opportunity for you to come to boot camp. We run them about every other month. So if you're delivering a little bit later on, not to worry. But you can use Mom Cozy for NAPS 25 for 25% off of any prenatal class or for our pre-baby boot camp. So pre-baby boot camp is a weekend-long event. We send you boxes, we send you swag. It's so much fun. But if for whatever reason you can't make that work, you can also use this discount for 25% off of any prenatal class. So breastfeeding basics, labor and delivery prep, newborn essentials. I believe our CPR course is also included in this. So just something, a little thank you for all of you who showed up tonight to be with us. So go ahead, take a picture of that, use that code, and hopefully I'm also, right, I'm the primary educator for NAPS as well. So I'll be seeing you again. Amazing.
Thank you so much, Laura. We really appreciate it. And give yourself some shine, ladies. Thank you, moms, for showing up. This was so much great information for this beautiful group of moms. I noticed we have a lot of July babies coming in. We have a lot of fall babies coming in. So we're really excited to get this information. And as a reminder, this is all month. This is all of June. So thank you for joining us here tonight, and we have more webinars on the way. I saw a question in the chat about the recording of this webinar. Yes, you will receive the recording within a week. So thank you so much. So hey again, hey everybody, I'm Sonia from Mom Cozy. We are a maternity and baby brand that started back in 2018 with the focus of creating comfortable pumping and nursing bras for mom. And since then, we've grown into a global brand supporting over 3.6 million moms across 60 countries with over 200 thoughtfully designed products for both moms and babies. Laura, do we have the Facebook link
For
to join the Facebook community? It's such a great community
oh my gosh,
for
for Mom
moms to
Cozy, yes,
join.
of
If
course
we
we
can go,
do.
do we have that?
Oh my gosh, yes, let me pull it up. Of
Because
course,
I see a lot of engagement in the chat, and it's so exciting to see the engagement with the
absolutely.
moms.
Here,
And
I'm
this,
gonna,
I want you guys to come on over and join the Facebook
here we
community.
go.
Yes, join. Okay, so go on and scan that, guys. Join this. So scan the QR code and go on and jump in. It's a safe and supportive space for moms to connect. You guys can ask questions, you can share your stories, you can offer peer-to-peer support and just encouragement overall. Just, moms have to be here for each other. This is a journey. You don't have to go through it alone. And we want to make sure that you are able to connect with your village.
Absolutely. Absolutely. Having a village, having that community is one of the most foundational things in that postpartum health for you all, for sure.
It is really important. So please, I encourage you to, take a screenshot, join it if you can. Um, but we want to make sure that you are able to connect with like-minded moms. Also, do we have the QR code for feedback?
I'm not sure that we do, actually.
Well,
Not in this one. Let me check. Let's see if it's after the questions one. And we are gonna go ahead and take some questions as well. But no, I don't think that we do have the QR code for the feedback in this one. Ooh,
well,
we'll mark that
well,
down because
listen, listen, listen. Well, let's go into these questions because I saw a lot of great questions in the chat. I've been engaging with you guys during the entire presentation, so let's get to it.
I love this. I'm scrolling through right now and I'm like, oh my God, I love
Yeah,
all
oh
the
no,
ways that people are.
yeah, the chat was amazing.
I love this. I saw that somebody joined Naps. I saw that somebody joined Naps. Thank you so much. I see you. I see you. Oh, this is amazing. Oh, so good. Okay, my friends, why don't we go ahead? For some reason, I am not able to see the Q&A. I'm not able to see that on my end, but I can see the webinar chat. Is it okay if we just do a couple of questions in the chat?
Absolutely.
That
Let's go
sound
for
cool?
it.
Okay, great. I love it. I love it. I love it. I love it. Amazing. Okay, anyone want to start us off here? Oh, perfect. Okay, Nicole, what can you do to help? Oh yes, the separation of abdominal muscles during pregnancy. So Nicole,
Great question.
that is an amazing question. If that is something that you're experiencing right now, the best person, this is not my specialty, okay? So the best we need to get you in with somebody who knows exactly what they're doing, right? Who specializes in this. So the best thing to do is to talk to your OB or your midwife about that. And usually it's a pelvic floor physical therapist who is also going to help you with that posturing, and help you kind of recover from that, right? So that could be a good place to start, okay? And you guys have so many wonderful questions. I'm going to try to get through as many as we can. Okay. I promise. Okay. If pelvic floor therapy is needed, do you go to OBGYN or primary care doctor to get it if you need it after the 6-week checkup? Excellent question. You go to whoever is going to give you that referral. If you need a referral for insurance for pelvic floor physical therapy, you're going to whoever is going to give you that referral. Usually, right, OBs will kind of end their care after 6 weeks. So maybe then you would go to your primary care provider. But sometimes there's a gray area. So I would check in with OB first, and then if we need to, we'll go to PCP. Kathy, since there are more wearable pumps now, is a double electric Spectra still better, or a wearable pump like Mom Cozy enough to keep supply? That is a great question. This one truly depends, Kathy, on your personal history, on if there is anything that we are noticing. This is something that we can also go through during prenatal lactation visits, right? Virtual prenatal lactation visits that are hopefully covered by your insurance. But that's a loaded question. For some people, depending on what their goals are, a Spectra might be better. For other people, depending on what their goals are, that Mom Cozy wearable pump is amazing, right? Having that hands-free, having that freedom. So it's really going to be on a person-to-person basis. How early can we collect colostrum in pregnancy? And what step-by-step do we go about giving? Again, oh my God, amazing question, Alejandra. This is also something that we would go over in prenatal, in prenatal lactation consults. The down and dirty of it is that you want to be past 37 weeks or more, right? Over 37 weeks or more. And you want to talk to your OB or your midwife about it before you begin to make sure that there are no contraindications, any reasons that you wouldn't be able to do that. Great question. How often should you measure for your flange size? Great question. So we want to do flange sizes. Typically after the baby is born is a fine time to do it. Sometimes flange size can change when your milk comes in, but we are always sizing up. Okay. So anytime in that postpartum period, those few days after birth is a good time to do it. Poop question. Yes, Mallory, I love it. Stool softeners provided at the hospital. Yes, ma'am, they are provided for you at the hospital. Don't go spending your money, okay? Put it on the hospital bill, all right? They're going to provide those for you from the pharmacy. You don't need to bring your own, okay? Is the fundal massage over the skin? Yes, it is. Yep. So it's right over the skin. We're like kind of massaging your belly there. C-section recovery, nervous about not being able to move around and need to care for baby. Alyssa, this is a really big concern, right? So for you, I want you to lean into that community. I need you to
Mhm.
sit down with your partner, and I need you to make a list of your helpers, not your visitors, your helpers, because you're absolutely correct. It's going to be a little bit, your recovery is going to be a little bit longer, okay? And so we're gonna need those extra hands, right? So that you can recover, and really, really be there, really be present, and show up for your brand new baby. How can I get a midwife? Maddie, yes.
Yes.
Love midwifery care. The best place to start is in a Google search. I'm not gonna lie to you, okay? The best place to start is in a Google search. Midwives near me, midwifery practices near me. That is a great place to search. And then you kind of look into those, right? You can start reading those reviews, okay? How can you tell when the baby is full with breastfeeding? Usually they're relaxed, they're asleep. Use that code, Sabrina, use that Mom Cozy code that we gave you and sign up for my breastfeeding basics class. It's happening in a couple of weeks. I would love to have you. We go over all of this. Oh my gosh, you guys have so many good questions. I love this. I want to make sure that we're saving time. I'm only going to take 2 more, okay? Because I want to make sure that we're saving time for our amazing giveaways. Oh, Amanda, thank you. It is a great Q&A session. It's because of
It
all
is
of
a
you.
really good Q&A, Laura.
You
I
have
have to
great
admit,
questions.
I
Can
love
you
the
tell I'm
questions.
sweating trying to get through all of these. You guys are amazing. Are birth doulas recommended? Okay, I'm a little biased because, hi, birth doula here. Yes, all of the research supports that doulas are present. If a doula is present during your birthing experience, you are decreased cesarean section, increased positive birth outcomes for both mom and baby. Okay. Yes, 100% doulas are recommended at birth. Yes, absolutely. Okay, last one. Let's see. What do we got? Oh my goodness, oh my goodness. Okay, a lot of these are about pumping. A lot of these are about pumping. We can go over them in your prenatals, okay? Check that insurance code. I loved the doula one, flanges, um, mobile pumps. Oh my goodness, milk production. Tips on, oh gosh, you guys have so many breastfeeding questions. You need to join me. Oh my goodness. Oh, I really need to shout this one out. Oh, this one gave me chills. Danielle Garcia Newton. As a woman of color, a woman in general, what should I be aware of when navigating postpartum care, especially when it comes to advocating for myself in systems that may not fully see me or support me? Oh my gosh, I feel like I could just like cry right now. This is so important, okay? Advocacy for yourself is incredibly important. I'm going to give everybody kind of first and foremost, like I said, I would highly recommend a birth doula
Mm,
for anybody. They are your unbiased protection in the hospital. They are your support. They are your cheerleader. They are your advocate. They are bringing you back to your why, right? Constantly, right? They are playing defense against everything else, right? They're giving you education. I cannot recommend that enough. So if you do not have a doula, I would highly recommend looking into one. Um, Second, right? You need to trust your intuition, okay? You have to trust your intuition. This is also going to be leaning on the community that you've made for yourselves, right? So hopefully your doulas, your support people, your family, your friends, right? I want you to trust your intuition. If you know that something is wrong, if you know that something isn't right, you are continuously going back. It doesn't matter how many times you have been turned away. You are going back. You are going back. You are going back. You are going back until something is done. Okay. This is why women slip through the cracks, right? This is why this happens in the postpartum period. And we don't want that to happen to you. So please, right? Just trust your intuition. If you feel like something is wrong, trust yourself to know that. And then you find the person who is going to listen to you and make sure that you get the answers that you deserve and that you need. That was such a powerful question. Such a powerful question. Amazing. Okay. Giveaways?
giveaways, it's time. Guys, that was the most amazing Q&A session ever. That was a really good Q&A. Thank you so much for your questions. Thank you so much for your engagement. And I
Mm,
see the questions still coming. Okay, so This is the most exciting time of the call. Now is the time to announce the Cozy All-Star Bundle that will be the giveaway for tonight. So, what I will do, these are the rules. I will select two names at random. And if you are present, please say here in the chat or in the in the Q&A. Let us know that you're here. You have to be present. I see Jessica saying here, Angelina, Lauren, Sabrina, they're already saying here. So I will select two
Yes.
names at random. And these two lucky winners will receive the M9 breast pump, a belly wrap, and therapy pads. So I'm really
This
excited.
is
Let's
like the best
see.
giveaway
I know
ever.
this is a really good giveaway.
Oh
And
my
don't forget,
gosh.
if you're not a winner tonight, we have three more sessions in June. So join us here. Okay? So let's see. The first name that I am selecting is Alexis Kinkle.
Ooh, Alexis, are you here?
Alexis, are you here?
Yeah.
You're
All
here,
right.
you're here. So listen, make
Congratulations.
sure that you
She's so
email me at mcp@momcozy.com and email me your name and your information and we will go from there. Okay,
Look
so
at this chat
we have
congratulating
another,
her. If
we
this
have
is not
another.
the
Let me see,
best
let me
panel,
see.
that this is incredible. I am like overwhelmed with the support.
All right. The next winner is Brianna Toy.
Brianna, are you here?
Brianna, are you here?
Yeah. All right.
Okay, again, please email me at MCP. Do we have that information? Do we have that screenshot, Laura, or no?
I don't
I can
think
type it in
so.
the
You want
chat.
to type it in the chat?
Okay. MCP@momcozy.com. Okay? All right, listen, congratulations to our winners. And listen, we have three more webinars coming up in June. And I hope that you guys will continue to join us. That's all
Mhm.
we have for today, guys. Thank you so much for being here. Thank you so much for showing up for yourself. Tell a friend and tell a friend. The next webinar will be June 11th.
Yes.
Postpartum mental health. Please join us again. Laura, did you have anything to add?
No, that's it. I'll be here. We're gonna be rolling together for every single webinar this month. Okay.
Yes.
So come back and join us. We cannot wait to have you take a look at naps, join the Mom Cozy community, please, 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 please. And I hope that I hope that you had a good time. I hope that this was helpful and hopefully we'll see you next week.
See you next week.
All
Thank
right.
you.
Bye everyone.
Bye.
Have a great night.